I think I have it all pulled up. So, all right. Thank you for joining me, everybody. My name is Dr. Joseph Coppus. This is Delta Neuro Health, and today we're going to be talking about POTS and functional neurology. So, who am I? Like I said, Joseph Coppus, the owner lead clinician here at Delta Neuro Health. I'm also the host of the Neuro Wellness podcast and the Neuro Health broadcast. I'm also a husband, soon to be father, and actually a former POTS patient. So my story with POTS started when I was actually in high school. I sustained a concussion when I was just unplugging a computer or a camera from underneath a computer. The bell rang, startled me. I shot my head up, slammed the back of my head on the bottom of the table, and concussion ensued. Afterwards, I was dealing with some pretty bad headaches, and for the next about 4 years or so, I was dealing with a lot of syncope episodes that later on I realized was um, an issue associated with POTS. So I was passing out in the shower, I was passing out from exercise. So luckily, I was able to find a functional neurologist, a practitioner down in Georgia, and they were able to help me. And ever since then, I have been dedicated to learning functional neurology, practicing functional neurology, and helping those who are dealing with similar situations. So, what is POTS? We should probably define it first, right? So, POTS stands for postural orthostatic tachycardia syndrome. So, let's break that down a little bit. Postural, meaning related to the position of where the body is, right? So, you see this man on the slides, he's laying down, then sitting up, and then standing. Okay. So, orthostatic, so that position of the body being upright is where people tend to be symptomatic. Tachycardia, meaning an increase in heart rate above 30 beats per minute or more. And then syndrome, that's just the word to indicate the symptoms, the cluster of symptoms that's associated with POTS. Okay. Not everybody is going to have the same symptoms when they have POTS. They're usually all over the place and they seem like they're all over the place, but when you follow the common denominator of what's causing them, it starts to make sense. So we'll get into that here in a little bit. So just a few quick facts about POTS. 90% of POTS are actually female. Average age of sufferers of POTS is 15 to 35 years old, so relatively young. 50% were actually teenagers. About 1 million to 3 million Americans are suspected with POTS, but I would guess that because diagnoses typically take a while and people may not be as well versed in POTS, I think that this is a lowball number. And then this is going to be an important piece for the rest of the presentation, and that is POTS is a problem of the nervous system, not of the cardiovascular system necessarily. Even though we have that tachycardia, it's more of a problem of the nervous system. So a little bit on that and more on that here in a second. Okay. So some common symptoms of POTS, not a all-inclusive list, but these are some of the most common. I'm just going to read them off for you. So dizziness or lightheadedness, probably the biggest one we see. Palpitations, shortness of breath or air hunger, brain fog, fatigue, focus problems, insomnia, trouble sleeping, digestive complaints, bloating, nausea, things like that, sexual dysfunction potentially, anxiety, blurred vision, racing heart, chest pain, shaking, sweating, trouble regulating your temperature, and then, of course, fatigue. So very common. So what actually causes POTS to develop? Believe it or not, there are many causes of POTS. Mine, like I mentioned, was from a head injury or a concussion, but it can also come from other types of traumas. Viral infection is one of the probably the next most common, if not the most common. Especially COVID-19 is what we've seen quite a bit since 2020. There's certain medications and vaccines that can trigger it. Major surgery, such as going under general anesthesia, tends to trigger it. Pregnancy, mold, Lyme, Ehlers-Danlos syndrome is a common one as well. So not, again, not an exhaustive list, but here are some of the common ones that tend to show up in our office. So with all of these different causes of POTS, what is actually going on? So here we're going to talk about the neurophysiology of POTS, what's actually going on. So we talked about all these different triggers and they're all very different. A head injury is very different than COVID, right? More or less. But what's happening is there's alterations or dysfunction of the autonomic nervous system. And the autonomic nervous system is housed throughout the brain, but typically we're looking at the brain stem, tends to be the most common area of involvement. But the autonomic nervous system is our automatic nervous system. So it's that subconscious part of the nervous system that we don't really need to think about in order for it to be active, right? So these are things like heart rate, digestion, breathing, blood pressure, things of that nature. So whatever the trigger might be, in POTS, the issue is that the parts of the brain that are controlling these automatic subconscious processes, like that lizard brain you may have heard of, those processes have been uh, impacted negatively. And now we have a miscommunication between the brain and those organs of vital function. So, like I said, POTS is a connection issue. It's not necessarily a cardiovascular issue, even though one of the more common symptoms is racing heart. We have that tachycardia with standing up. It's not necessarily a cardiovascular issue. So it's the brain not being able to communicate with the heart and the rest of the body effectively. And I mentioned a little bit about the gut-brain axis, or sorry, I mentioned a little bit about digestive problems that people with POTS and dysautonomia tend to have. So you may all be familiar with the vagus nerve, maybe not, but that's the part of the brain, the nervous system that connects the brain specifically to the gut, and then the gut then communicates to the brain. There's this constant communication going on. So in dysautonomia, in POTS, there is a discommunication or dysregulation in the connection between these two parts of the body. So if the brain is not talking to the gut appropriately, we're not going to digest food well. We're not going to be absorbing nutrients well. We're probably going to be bloated. We're probably going to feel nauseous, so on and so forth. So a lot of times addressing the gut is very, very important to affect brain function. 90% of serotonin is produced in the gut. However, the same holds true for the brain. By addressing the brain, oftentimes we can actually make improvements in gut function. So not many people know that. And then something else that you may have noticed on that list of symptoms, and you may be experiencing yourself, but a lot of people with POTS struggle with cognitive symptoms. Okay. So I mentioned things like fatigue, focus issues, brain fog, memory. These are all things that are impacted by POTS. And you might be asking yourself, well, what does that have to do with kind of the lizard brain, right? So think of it this way. If POTS is controlling blood flow regulation throughout the body, right? And your brain is the highest part in your body, right? And if we're not able to get blood up into the highest part of our body, the brain, it's not going to have the fuel it needs to operate, right? So I have a picture of a Ferrari here. So you could have a Ferrari of a brain, one of the fastest, best running brains in the world. But if it's not getting the fuel it needs, it's not going to be able to run. So I'm gonna explain here in a little more depth. So in the very beginning, I showed a man who was lying and then seated and then standing. Okay. So that's the positional change. The POTS is positionally dependent, right? So when we're laying down, our head is equal to our feet and is equal to our heart. Everything's on an even playing field, right? Gravity is pushing down on everything equally. Blood is able to pump into our head just as easily as it is to pump into our feet, and vice versa. So this is nice and easy. As soon as we go from lying to seated to standing, now we change the relationship of where our heart is relative to our brains and our feet. So something a lot of POTS patients also struggle with is pooling in the legs, right? So we've got gravity pushing down on our heads and our hearts, pushing blood away from our head towards our feet, and then our blood vessels and our muscles have to pump blood back up into our heart. But in POTS, this mechanism is disrupted. So what happens is blood kind of goes away from the head into the feet. If the blood's going away from the head, we're not supplying with that Ferrari with the fuel that it needs to operate. So a lot of people just, I mean, they tell me that they just don't feel sharp anymore. They feel dumb, not that they are, but you can imagine that if you're not getting the fuel or if you're not giving your brain what it needs, it's starved of oxygen and nutrients, it's not going to be able to run. Okay. Okay. So I also mentioned the autonomic nervous system, right? That automatic nervous system. So within that autonomic nervous system, there are two kind of sides of the coin, two sides of the autonomic nervous system. And some of you may be familiar with this, but that is the sympathetic and the parasympathetic nervous system. Okay. So I've also deemed this our survival state versus our thrival state. Okay, so we can see here in the parasympathetic category, we have pupillary constriction, slower heart rate, our airways constrict, so on and so forth. So you can read that. But basically, the parasympathetic is our rest and digest, or our feed and breed. Our sympathetic is our fight or flight. So if we have POTS, which is under the umbrella category of dysautonomia, or it's under the umbrella term dysautonomia, dysregulation of that automatic nervous system, these two, parasympathetic, sympathetic, fight or flight, rest and digest, are at odds with each other. They're not operating the way they're supposed to. So some people often get stuck in the sympathetic or a fight or flight state, right? So their heart is racing, maybe their blood pressure is fluctuating, maybe they're sweating profusely, like we mentioned earlier. They have that anxiety. They always feel like they're being attacked or chased by a tiger. And what happens is when we're in that sympathetic fight or flight panicked state, our nervous system is going to shunt blood actually away from important internal organs like our digestive tract towards our like big muscles like our biceps and our quads so that we can either fight or flight or flee. Um, but what happens in doing so, we starve the gut of blood again, which is going to make digestion that much trickier. So one of our big goals with POTS is to actually get people into typically a more parasympathetic rest and digest state overall. So here's a little cartoon. We've got you can fight, I'm gonna flight. So in today's day and age, we don't really have these types of fears anymore. We're not really being chased by tigers or saber-toothed tigers or whatever anymore. But what we do have are things like deadlines and bosses who are breathing down our necks and finances and bills and work stress, life stress, so on and so forth. And kind of the good thing about a bear or a tiger chasing you is that once it's over, it's over. You either died or you got away, your body can relax. The unfortunate thing about today's day and age is that sometimes those stressors don't stop, right? Like you can go to work 9 to 5, you're stressed all day. You might come home, get a little respite, and then the next day, right back to it, right? So stress management is very important, but you can just see maybe why there are so many people who might have dysregulated nervous systems just with the way that our society is kind of structured now. So we want to get into more of a rest and digest. This lady is, having a good day there. But the flip side of that is feed and breed as well. So I mentioned sexual dysfunction as well earlier. So not only is digestion disrupted, but potentially fertility or things of that nature can be dysregulated. Our hormonal cycle can be dysregulated because we're not worried about procreating when we're just worried about survival. Okay. So that goes back to that thrival versus survival. We want you to be in a thrival state, not in a constant survival state. Okay. So what is typically recommended with someone who has POTS? So typically you go to cardiologists, not to speak for them, but what I tend to see recommended to my patients before they get to me is increased salt intake, which makes sense. If we have difficulties with, blood pressure and heart rate, blood pressure is not able to fight against gravity to get blood up into our head, then, it makes sense. If we increase salt intake, our blood pressure is going to increase. We're more likely to offset the impact of gravity. Okay, so that's great. Compression stockings. Why does that make sense? Because if blood is getting stuck in our feet, the compression stockings help to compress our lower extremity muscles and veins, and it helps to pump blood back up into our heart so it doesn't get so stagnant in our lower extremities. Sometimes people will get recommended a beta blocker to help calm down the heart rate. And then if you're lucky, sometimes you'll get recommended cardiac rehab, which is great, but doesn't always get to the root of the problem, right? Or doesn't always fix the whole situation there. And these are all really good band-aids, right? But if you subscribe to what we were talking about earlier and understand that this is a connection issue, the salt isn't necessarily fixing that connection. The compression stockings aren't necessarily fixing that connection. The only thing that kind of comes close is the cardiac rehab, but it's not all encompassing. Okay, so what do we do differently here at Delta Neuro Health? So first and foremost, we are going to take every case individually. We begin with a specific 3-hour neurological exam to determine which parts of the brain are not connecting appropriately with the body, right? What part of that autonomic nervous system is perpetuating that POTS, okay? After we have performed this in-depth exam and we have a great picture of your particular neurology, that's when we create a customized neuro rehab program specifically to integrate into these areas of the brain that have been affected by COVID, concussion, pregnancy, whatever it was. So we help to kind of rebuild those areas using what is called neuroplasticity. You may have heard of it, but neuroplasticity basically means the brain has the ability to adapt and change given the appropriate stimuli, right? So if we know that the brain has the ability to change, and we know that the brain has been changed negatively by whatever reason, then it stands to reason that we can change it for the positive. So what we're going to do is, like I said, customized, non-invasive neuro rehab program with our goal to rehabilitate that part of the brain, get your objective findings looking better and your symptoms looking better. One of the key things that we do with POTS, and this word might scare a few people, but tilt table therapy. I know a lot of people may have had the tilt table test, which is not a fun experience if you've had it, um, typically, but our tilt table therapy is quite a bit different. So we're still using a tilt table. However, we're using it to the patient's tolerance. So we want to find where the patient can handle being upright, and that's where we administer our treatments. Okay. Everybody is going to respond differently, and we have different variations with the tilt table test or treatment. Um, that being said, it can be a very helpful tool with those suffering with POTS. So then we look at also supplementing, dietary changes, and lifestyle support as needed, and then POTS-specific physical exercises. So at Delta Neuro Health, we believe that patient care is a collaborative effort. So we never want you to become reliant on us or any practitioner for that matter. So what we want to be is right here in the middle of the picture. We want to be kind of the guys holding up that bridge just to get you over that chasm, right? Get you to that next phase, and then give you the tools and the strategies and the therapies and exercises that you need to continue your care. Okay. In the beginning, it might be a little bit more intense with us, but we want to empower every patient to take their care into their own hands and only use us as needed. So we're going to open it up for questions in just a second, but I just wanted to do a quick plug and say, follow us on social media. We're on Instagram, Facebook, YouTube, TikTok, and then we have our current podcast, the Neuro Health Broadcast, on Spotify and Apple. Our next event is going to be March 21st, 2024, 7 p.m. Eastern, same place here at Delta Neuro Health, as we're going to be discussing the ultimate guide to managing migraine. So thank you very much for your attention, and I look forward to answering your questions.